does a patient belly size telling about their health?
Well, it's telling a lot of things, to be honest. So I'll start from a very old proverb. As you know, it says that longer the belt, shorter your life. And I see the belly fat or the belly size a kind of camera. Now, if you will remember traditional medicine, people used to be diagnosed looking at the color of the eyes, looking at the color of the skin or the tongue. And then came an era where physicians will diagnose patients feeling their pulse. But now in the modern medicine, I think looking at the belly size as a camera to the whole spectrum of disease or diseases a person may be carrying with him, which is quite apparent. Now, belly size, again, I would say, uh, is a problem. And there are a lot of studies and research that have shown that it does directly lead to more health risk and common health or medical problems. And a lot of them are linked. And as I can give you a lot of examples, but it is said that obesity, obviously, which includes large belly size, is the mother of more than 200 diseases. So you can imagine, if you have a big belly size, obviously, which is related to obesity by and large, then obviously you are at risk. And it is not just the subcutaneous fat; it is the visceral fat that is surrounding the visceral organs, such as liver, the spleen, kidney, bowel. So those are now should be estimated, and there are means of estimating them either through MRI or PET scan, and also some very simple devices we have that can very
Body
accurately,
composition, right?
exactly, body composition machines. So they can estimate what your visceral fat percentage is, and that is directly related to your risk of cardiovascular disease is number one, and a lot of other metabolic diseases, including cancers. So it is extremely
So
important.
if a patient's belly size is big, is large, it means that in their body composition, their visceral fat is higher than normal, right? It's just like direct to each other, like.
No, I would say not always, not always.
Hmm.
You will be surprised. People may be lean and thin, and they may still carry a very
Yeah,
high
that's why
percentage
I
of
asked.
visceral
Yeah.
fat. Yeah, but invariably, this there may be a direct correlation, but not always.
Okay, okay. And why is that belly fat is riskier than like having a big like size of belly fat is riskier than having fat in other areas of your body? Like why is that exactly? Is it because of the visceral fat or is like any other reason for that?
Yeah, so when I say belly fat, so it is going to take into account mainly the subcutaneous fat. The fat
Mhm.
is, which is beneath your skin.
Skin, yeah.
But the visceral fat, obviously, it is difficult to estimate unless you do the body composition machine, MRI, or PET scan. But it has now been recognized that larger amount of visceral fat is relates to or directly related to underlying healthcare conditions such as diabetes, high blood pressure, even cardiac diseases are linked. So there's high cardiovascular risk related to high amount of visceral fat.
Okay. And does studies shows why is that? Why is it related to diabetes or like blood pressure? Like why a visceral fat is connected to that, but it's just like the fat in other area of your body is not that dangerous for you. Like it's why is it really riskier?
Yeah,
Like does
so
does that measure that in the studies or something?
no, indirectly it is related. There's no direct correlation, I would say, that the visceral fat,
Okay.
it equates to high amount of diabetes or
Hmm.
heart disease, or there's no definite pathophysiology to explain that. But it is a part of the what we call the cardiometabolic syndrome. So high visceral fat is kind of has been studied to be an important component of cardiometabolic syndrome. So where you put together diabetes, high blood pressure, obesity, and the heart disease, so they are all part of the mixed bag. So I would say that a higher amount of visceral fat that they have studied and has been researched has been shown that it does increase your risk of cardiovascular disease. And
Okay,
it's
okay.
also to do to some extent that if you have more fat, then obviously you're not utilizing your insulin, and
Okay,
so
yeah,
there's
that's
less of insulin sensitivity, and that increases the risk of further fat deposition and further development of diabetes. And all the medical conditions, they are linked with each other. So obesity is linked with diabetes, high blood pressure, high cholesterol, and ultimately leading to cardiovascular diseases.
true. And how people can reduce it? How people can reduce specifically visceral fat?
Yeah, so that's again a very good question. No, it is not easy. First of all, let me tell you. But one has to be persistent. We committed to reducing that fat. So you will see maybe in the gym that people start to do abdominal crunches and other exercises to get that fat. So they do not work, unfortunately. So spot reduction of fat is not possible. It has been shown through research. So best is have a good dietary control. So have a good dietary habit, control your diet, reduce your excess calories first of all, uh, eat the right amount, right food at the right time, and definitely reduce your carbohydrate, the sugar, fat intake. So this is probably the most important, and obviously do exercise at the same time to burn the calories. So this is a simple way, and
Okay.
then one can monitor how things do improve. An important part here also is to mention that alcohol leads to a lot of belly fat, particularly what people drink. If they're drinking, say, beer or lager
Beer
and so on,
belly.
beer belly, yeah, exactly. That's where
Yeah,
the name came from. So, so that is extremely important. Do not forget that. And then
that's
we must
true.
go a little bit in the science of it, and we should know what exactly or what is causing belly fat. Now, there are a few things that come to my mind, which I thought I'll discuss here. Why people do get belly fat. Number one is genetics. So it's in your
Mhm.
gene. If you're born with a gene where you are, prone to develop fat deposition around your tummy area, then it will be very difficult, but not I would say impossible to get rid
Mhm.
of that fat. Yeah, and then there is also a role of hormones, particularly testosterone. If you are low in testosterone and the other hormone is cortisol, high level of cortisol, which again there may be medical conditions, and as you will know that lack of sleep, high stress level, they do
Exactly.
both increase cortisol levels. So these are
Yeah.
important.
That's why
And
people that
thirdly,
are under stress, it's
correct,
harder for them to lose weight or lose belly fat because like they're under so many pressure and stress, and they have like a very high level of cortisol, and like
correct,
even simple acts like getting more sleep or like like doing some practices to reduce the stress,
correct.
it can help them to like achieve that goal with like reducing their belly size or like even losing weight.
Yeah, correct. So sleep is very important because if you do not sleep, and then again it's linked to stress. If you're stressed, you do not sleep well,
That's
and
true.
if you do not sleep well, you have
You're
a
stressed.
starving
It's like
to eat.
cycle.
So you eat more and you eat the junk, yeah, which you are not supposed to eat. A lot of sweets and
It's all
carbohydrates,
related. Like it's
all related. Yeah, correct. And then some people start to drink, so that makes things worse. And moreover, if you do not sleep, you do not feel like exercising, so that is another one. So lack of
that's
exercise
true.
is all are related to each other.
So I have
But
a question for you. Like for my information, because I listen to a lot of podcasts and I'm always curious about this topic. That as a heart, like as a cardiologist, cardiac exercises is better for heart health or strength training.
yeah, again, that's a good question, and there is always a debate or
It's
controversy which we will.
controversial, yeah. Like
So
I'm
first,
specifically asking about heart health, not like overall health or muscle health, muscle gain.
yeah, yeah.
I'm just like asking about specifically if you want to keep your heart healthy, which one do you recommend?
See, as the name says it says it all. Cardio. Cardio is for heart health. So definitely, you must do cardio to have a good cardiovascular health. There's no doubt about it. And but again, you have to have a combination of exercises. The strength training is also important. Balance exercises are important. So you have to have a mixture. But the name says it's cardio, so we know it. For cardiovascular health, you must do
So if you
cardio.
want to choose one, you would go with the cardio, but you
Exactly.
recommend a mixture of like cardio and strength training.
Correct. Correct. Correct.
Okay, thank you.
Yeah. And before I would just like to add another thing, which may be new to some people, that vitamin D deficiency
Mhm.
is very common, and I'm not sure you checked yours, but I check
Yeah, I
mine
checked.
regularly.
Like I'm so so serious about my vitamin D.
Yeah, so it is very important. And again, this is
Yes.
something we know only recently. Vitamin deficiency can lead to lot of problems, starting from heart health, your brain health, kidney health, and so on.
True.
But it's only recently I realized that belly fat is also linked. High amount of belly fat is also linked to low vitamin deficiency,
Hmm.
and this is again something to do with your insulin sensitivity and secretion.
So
So
taking
vitamin D,
vitamin D also help you like with insulin sensitivity?
correct, and
Oh,
also
okay.
improves your testosterone level. So
Okay.
these have got important implications as well.
Okay, thank you for sharing that. So, people that are watching, please check your vitamin D levels. And if you're not taking the supplement daily, it's better to take it daily. You recommend like 2,000 daily, or you're saying like 50,000 in each month? Like, which
Yes,
one do you recommend to your patients more?
yeah, again, it depends on the levels. So if the
Mhm.
level is really low, then definitely you should be on the 50,000 once a week.
Mhm, mhm.
12 weeks, I recommend. And then if repeatedly the levels come low, then I put them on a regular low dose level, like 2,000 daily or 1,000 daily,
But as
depending on the.
someone that it has a normal level, like they need to take it the supplement daily or not? Like I think they should, right?
Yeah, if their levels have been really low,
No,
then
no, no,
you
the
can.
normal ones. The people that, like, for example, if I check and I'm like 35 something and I'm in the normal range and I want to keep it this way, I don't want to make it like do you recommend for all the people take the supplements daily or not?
No, again, it depends on the levels, not also, because
Mhm.
vitamin D, if it's is a big range.
Yeah.
And even if the patients have normal, if they are at the lower end of the normal and they've
Mhm.
always been like that, then yes, you can continue. But I've surprised to see some patients,
Mhm.
elderly,
Yeah,
the vitamin D levels are really high. So obviously, I do not recommend using vitamin D, for them.
I understand. I understand. Okay, okay. Thank you for telling me that.
And the obesity, one more thing, as I said, that when you ask the first question, what does the large belly size tell you about?
Telling about the health, yeah. Is it the
No.
first thing that you notice in the patient when they're coming to your room? What is the first thing that you pay
Yeah,
attention to when
yeah.
people come into your
I-
room?
no, no, that's what I was going to say, because I diagnose a lot of diseases. Somebody will walk through my
Yeah,
patient door, and I can understand, what is going on. But I'm just being a little bit crude here, because it tells a lot about the personality of the person as well. So, it is again a sign of, I would say, in a crude way, it's a sign of laziness, lack of commitment, no clear goals towards health, and no clear goals, I believe, towards life. So, sorry for being a little bit blunt here, but I think that's probably is the reality.